This is Theresa Palkovic, physical therapist and owner of Valley Rehab Center. In our shoulder pain and rotator cuff video, we talked a little bit about cervical radiculopathy or neck issues being a cause of some shoulder pain. So in this video, I just want to show you a few exercises that you can do to help reduce any numbness or tingling that you might be having in your arm or shoulder, or going down the arm to the hand, and also show you some exercises on how to strengthen your cervical muscles and improve your head and neck alignment so that you don't lead to a cervical radiculopathy or don't develop those symptoms. The first thing that's most important is to think about your posture. So you want to kind of take an assessment, and if your head tends to be like this so that your shoulders are in front of your ears, we need to work on that, because the neck should be up and back so that your ears are in line with your shoulders. So one exercise that you can do at home is you can stand against a wall and you can just work on keeping your chin parallel to the floor and pushing that head back against the wall. Now, to add to that, you can pinch your shoulder blades down and back, and if you can, put your hands against the wall and then work on bringing your arms up overhead like a snow angel and back down. That exercise will help strengthen the muscles in your upper back and your shoulder girdle and help to reduce any arm or pain or numbness that you might be having. Now, a lot of people can't start there, so we recommend putting a towel or a pillow. So you can put a towel or a pillow behind your head and just start with pushing your head back against that surface, keeping your shoulders down and back and pushing your head against that surface with your chin tucked. If you can't get your arms all the way to the wall, then start as close to the wall as you can and work on bringing them up, and you might only be able to go to shoulder level at first and back down. Remember, pain is your guide. So if you're doing any of these exercises and you get increased pain or you get numbness or tingling that develops with the exercise, then you need to stop that exercise immediately. Now I'm going to show you a couple of stretches for your neck, because these neck muscles get very tight, especially when we spend a lot of time on a computer or on our phones holding everything in front. So they get very tight, so they need to be stretched out. So one stretch, what you're going to do is you're going to take and place your fingertips right along your collarbone like this. Hold your shoulder down and back, and then you're going to turn your head to the side, but then look up in the same direction. So it's tilted to the side and up in the same direction. Now when you're performing a stretch, it's better to perform that stretch for 30 seconds than to do like 5 or 10 seconds and then stop. So again, fingertips are along your collarbone. You turn your head to that side and then you tip it to the opposite side. So you're looking up and across like this. And you'll hold that for 30 seconds and then release it. Now when you do that stretch, you only have to do that about 3 to 5 times. Another stretch that you can do is to place one hand behind your back. You're going to turn your head to the opposite side, and then you're going to take your hand on that side and gently pull your head down and into your shoulder. Again, you want to hold that for 30 seconds. Make sure that you get a stretch. Now, when you're doing a stretch like this, you go to where you feel the stretch, not to where you feel pain. So this is where I feel stretch. This is where I feel pain. I don't want to go there. I want to stay at the stretch, hold it for 30 seconds, and then I'm going to repeat that exercise 3 to 5 times. Each time I should be able to move a little bit further into the range before I feel pain, and that's what you're trying to do. Another stretch is same position, arm behind your back, or if you had sitting in a chair, you could hold on to the chair, but arm behind your back. You look straight forward and then you just tilt the head to the side. And again, stretch. Here's where I feel the stretch, so I'm going to hold that for 30 seconds. Here is where I feel pain, so I don't want to go there. I'm going to go back to here and hold for 30 seconds. One final stretch that you can do is to find a corner. Place your forearms along the wall on each side. Now this is very important because you're going to lean into the wall, but when I say lean into the wall, I don't mean do this, because that's not really stretching what we want to stretch. You're going to stand up straight and actually walk into the corner so you feel a stretch across your chest. Make sure that you keep your chin tucked and your head back, and again, you're going to hold that for 30 seconds. So this is the proper way: shoulder blades down and back, forearm against the wall, you walk into the corner. You don't stand out here and do this, because that's going to only aggravate your shoulder, not help it. So you walk into the corner and hold for 30 seconds. So those are just a few activities or exercises that you can try at home. Once again, in all cases, pain is your warning sign. You're only going to go to where you feel the stretch, not to where you feel pain. If any exercise causes you pain or increases any symptoms in your shoulder or your arm, you should discontinue that exercise immediately and consult a physician or a physical therapist. I hope that these exercises are beneficial to you, and if you would like to have more information, visit us on some of our other videos.